One more COVID-related death brought in at 3 p.m. today at the morgue, which is already struggling with its capacity to cater for the increase in death rate amidst this Delta variant surge.
It's actually alarming. Just Sunday alone, we saw, Sunday night alone, we had like 16 dead on arrivals. I mean, that's a huge number. Unless there was a motor vehicle accident outside of the city, I just can't imagine people dying like that.
And so our capacity here it's not much as that. It's just this little space, like 130 spaces or something like that. We are overcrowding the body. At the moment, since last week Sunday, so really overcrowded. So we left the new bodies at a layout, and since now some are still at a layout now.
Moresby General Hospital Morgue, the only public mortuary in the big city, has been filled beyond capacity. There are bodies lying outside that are yet to be claimed. An officer in charge is calling out to the public to come forth and claim the bodies.
If the bodies, the relatives come to get the body out, then we put the body in. Otherwise, we can't do anything. We advise them to take it home, or they can take it out to Pinolong. This way, stop them back.
There's no preservatives. We're not doing that preservative or embalming process. So we encourage that's why we encourage the relatives to come and pick up their bodies. In that way, it gives us some room to move these ones that are waiting in.
While the space problem is raising grave concerns, particularly at this time when NCD is in the third week of the Delta surge, the hospital is struggling to monitor the magnitude of the surge. In the last 2 weeks alone, Moresby General Hospital has recorded 70 COVID-related deaths.
Per the pandemic orders, that all deaths that come to the mortuary facility or to the hospital need to have testing or swab done for COVID-19. There are some limitations, and also we have to need to get consent from relatives, and the feeling that we're getting from impression from relatives, some of them do not want to be tested, do not want their disease to be tested for COVID, and we understand and respect it. But in order for us to understand the magnitude of the problem, especially those that are dying in the community, we really need to do testing, all of this. There are challenges in terms of the manpower resource constraints with regard to this exercise. This week last week we issued a memo to conduct surveillance and testing on everyone that's entering the hospital premises. But in 2 days we found that it was exhausting for the limited number of staff that are doing the testing activities.
With an excess of 300 bodies, which is beyond the morgue's capacity, which can only hold 130, the hospital is looking at conducting a mass burial in the coming week.
We have submitted a list to the coroner and even to the National Control Center for approval, so that we can carry out the mass burial.